I'm doing part A. We're going to start off with active range of motion and cervical flexion. So now you bring your chin down to your chest. Okay, back up. And then you're going to start at the tip of the mandible, so the chin, and then go right above the sternum, and then do it again. And then you're going to record that, so 5 centimeters. Lateral flexion, you're going to bend towards your shoulder, just your head, perfect. And then you go the mastoid process, down to the lateral part of the acromion, and then bend. Then you're going to record that at 11 centimeters. And then you can also do the other side. Once again, the mastoid process, and then the lateral side of the acromion, and then bend. That is also 11 centimeters. So now we're going to do passive range of motion, so lay on the table. And we are doing extension, so you're going to pick up your head and then slide back. And your fingers are going to be right around the occiput. And then you're going to slowly, so they don't get dizzy or anything. And extend until you get a firm, you extend until you get a hard end feel because of their occiput hitting the rest of the cervical spine. And then next is going to be rotation, so back on your back. Same placement of hands. And then you're just going to rotate slowly. This is going to be firm due to the muscles stretching on the other side, which would be the sternocleidomastoid and the intrinsic neck muscles. Okay. And then we're going to do manual muscle test, so slide still on your back, but slide down a little bit. So you're going to put, I'm doing flexion, so I'm going to put my one hand over the forehead, one hand over the sternum, and then you're going to push up with your head. Perfect. Actually, you're going to start with your head up. Yep, just like that. Then you're going to push up. Perfect. This tests the sternocleidomastoid and the anterior scalenes. And then we're going to do lateral flexion. So you're going to be sitting again. You're going to have one. We're doing lateral flexion. So one hand on the side, the shoulder that you're testing, and then one on the side here, and you're going to push into my hand. Perfect. And we'll also do that on the other side. Perfect. And these test the sternocleidomastoid, the scalenes, and the paraspinal muscles. Now we're going to do the Valsalva test. So you're going to make a tight fist so no air can get through. And then you're going to take a deep breath in, put your fist up to your mouth, and blow out as hard as you can. Perfect. This is positive if there's increased spinal or radicular pain, and that would be an indication of a herniated disc. So now we're going to do a cervical compression test. So you're going to get behind the patient, interlock your fingers, and put them on the top of their head. Then you're going to apply an axial load down through, and that would be positive if there's pain in the upper C-spine or either of the upper extremities, and that would be due to compression of the facet joints. And now we're going to do distraction, so we're going to be back on the table, laying down, and then one hand's going to be underneath, fingers by the occiput, one hand by the chin, and you're just going to pull, and you're going to distract the spine, This would be positive. Positive symptoms are relieved or reduced because you're just distracting the spine. Um, and it would be compression of the facet joints again. So now we're going to do 2 mil sign. So I'm going to sit back down. And then you're going to find Erb's point on the back of the neck, which is the base of the posterior triangle in the neck. And then from there, you're going to take 2 fingers, and you're just going to tap down the brachial plexus, just like that. And you start out kind of easy, and then if they don't have any symptoms, then you do a little more harder. But that would be positive if there's pain or numbness along the nerve, and that would be trauma in continuity of the brachial plexus. Next, we're going to do radial nerve tension test. So we're going to be back on the table. Have your shoulder off the edge. So you're going to take and grasp the hand and the upper arm. And during all these steps, you need to ask if they have any symptoms that come back. So depress, abduct, and internally rotate. And then we're going to extend. And then pronate the forearm. Well, before that, you're going to ask if you have any symptoms. If they say no, then you pronate the forearm. Then you're going to flex the wrist and hand. Then you're going to ask if they have any signs or symptoms. And if not, you're going to tell them to laterally flex their neck to their right, since we're doing their left arm, just like that. So without any of that, positive would be if they have signs or symptoms, and that'd be abnormal tension on the radial nerve. So now we're going to do the biceps brachii reflex. So to make it easier to find, you're going to push up against my hand, and you just find where it is. Then you're just going to relax. Then you put your thumb there, and then you're going to hit it with the reflex hammer, and when you hit it, you're going to feel the contraction of the muscle, just like that. And I felt it. It'd be a positive test if there was hypo or hyperreflexia, so not any reflex or too much. And if it was bilateral, then it would be an upper motor neuron lesion, and if it was just unilateral, then it's lower motor neuron lesion. So now we're going to do triceps. So yeah, just kind of angle. So then to find that easier, you're going to have them press against your arm, just like that. And then you're going to have them rest at 90. Then you're going to do the same thing. You're going to tap with the reflex hammer, and you're going to feel the contraction of the triceps, just like that. And once again, I felt a little contraction. So just like the biceps brachii reflex test, it'd be positive if there's hypo or hyperreflexia, and just like the other one, it's if it's bilateral, it's due to the upper motor neuron lesion, and if it's unilateral, it's a lower motor neuron lesion.